Good afternoon, everyone. It's my honor to be here and give you the presentation about the challenge China and children healthcare system in China under the new policy of the Universal Child Policy in China. Today, the outline includes 6 parts. The first is the background and aims. Second is the method, and the third and fourth part is a simple introduction about the family planning policy in China and the MCHC system in China. And the final part is the potential challenges, and the last part is the conclusions. So first is the background and aims. I think everyone of you has knows the family planning policy in China, especially when talking about the one-child policy. After implementation for more than 40 years of the one-child policy, here are some effects. The fertility rate has decreased to a very low level. However, there are some drawbacks. For example, the accelerating population aging and the skewed sex ratio and the decline in the working age population. So under this condition, China has put forward and implemented the Universal Two-Child policy since the first day of January 2016. So under this background, we want to discuss what are the potential challenges of the new policy we bring on the maternal and children healthcare system in China. Okay, the next part is method. We made some literature reviews, and the reference from key articles have been searched by hand. About 116 articles were reviewed. However, there are very little articles which mention the effect on the maternal and children healthcare system. So based on the literature review and our knowledge on the China's maternal children healthcare system, some thoughts about the potential challenges were put forward. The third part is a simple introduction about the family planning policy in China. Here is a simple figure about its development history. Before 1970s, it's basically a free fertility policy. And after 1970s and until the end of 2015, here are two kind of policies. The first is the one-child policy. I think everyone of you know it. And since 1990s, the family planning policy relaxed. First, in rural areas, rural families with a girl as the first child could have a second baby. And the married couples who both are from the one-child policy, one-child family can have a second baby. And since 2013, they can have 2 child if one of them are from the one-child family. And now the Universal Two-Child policy is under implementation. Before the responsible government department of the family planning is the National Population and Family Planning Commission of China. And since March 17th, 2013, it was merged with the Ministry of Health of China, which is responsible government for health system, and formed a new department which is named the National Health and Family Planning Commission of China, and it's responsible both for the family planning and health system. By implement the Universal Two-Child policy, the government wants to improve the people's fertility preference and thus to solve the population challenges in China. However, the expected policy effects shown above are unsure, because some studies have shown that the role of fertility policy is diminishing fast, and that fertility contemporary China is socio-economically determined. We can take an example from the selective two-child policy. The effects of previous selective two-child policy were not satisfied as expected. By the end of 2015, only 2 million of 11 million eligible couples applied for permission to have a second child. Okay. Here is a simple figure. The upper part is family planning policy, and the lower part is the total population number and the total fertility rate. Also, since the 1990s, it has implemented the selective two-child policy. However, the total of fertility rate is still decreasing. Yeah. Previous surveys show that China has indeed become a low fertility culture, and some researchers even think that China will fall into the low fertility rate trap. And for the reasons, it mainly include the high cost of rearing a child, especially for the education in China, and the effect on parental lifestyle. Also, the new policy is unlikely to lead a very large increase in the average birth rate in China as a whole. Increase in fertility may be great in a particular population, for example, the advanced aged women, and in some particular regions, like some rural areas and small towns. In several days ago, Pian Wang, Vice Director of the National Health and Family Planning Commission of China, said that there will be more than 17.5 million new births over the nationwide in the year of 2015. Okay, as is expected, there will be a 1 million new births increase compared with the last year. Maybe that's related to the new policy. Yeah. So next part is maternal and children health care system in China. I will give you a simple introduction. It mainly includes three aspects. The first is the medical service, and the second is the public health service, and the third is the maternity insurance. I will give more introduction in the later part. Okay. The final part is the potential challenges. Overall, the fertility rate after the universal two-child policy will be a key factor that brings challenges to the health system now and in the future. So, based on the hypothesis that the new policy will play a positive role in improving the fertility preference and the population number, we discussed the potential challenges. So, first potential challenge on the medical service. According to the hypothesis, in a long time, the number of pregnant women, newborns, and children will increase, which means there will be demand for more medical services, more medical resources. And some studies have shown that under the policy, the greater challenge currently China's medical service is facing is the insufficient number of obstetric medical resources and pediatric medical resources. First is the obstetric medical resources. This is a prediction result of the gap between demand and the fixed supply of nationwide obstetric beds under the two-child policy. We can say in the later 5 years, there will be a very big gap between the demand and supply, and it will be the biggest in 2018, which is about 86,241. Yeah, and this figure is just the same like before. It's a prediction result of the ratio of supply and demand of nationwide obstetric beds on the two-child policy, and it will be lowest in 2018. It will be just 8.79. All the gap is below in one, which is the balance between the demand and supply. So besides of the obstetric beds, there are gaps between demand and supply of other resources. For example, the obstetricians, midwives, and nurses. So according to coping with the challenges, first, more obstetric medical resources are needed, and second, hierarchical medical system is more urgently needed to be implemented. Because in China, people almost like to go to high-level hospitals to receive the medical services. Yeah. And this is a pediatric medical resource. It's also a prediction result of the gap between demand and supply of the pediatricians. We can see in the later 5 years, China maybe need to add about 200,000 pediatricians under the two-child policy. And besides that, there are gaps between demand and supply of the pediatric beds and nurses. Some studies have shown that the low incomes, highly pressured working conditions on the demanding parents all contribute to the unpopularity of pediatrics as a specialty in China. And for that, first, more pediatric medical resources, especially the pediatricians, are urgently needed. It could further increase the enrollment number of pediatric students, and it improves their working conditions and so on. Back to the first slide. In a short time, number of pregnancy women of advanced age who have already had one child may increase quickly. However, they are the high delivery risk people. We have made a literature review before. The results has shown that the risks of maternal complications and fetal complications of them are rather high. Okay, this is the risks of maternal complications, and it's really high. And this is the risks of fetal complications. Yeah. And the potential challenge too is on the public health service. In China, the basic public health service package includes 13 projects. Among them, 3 are provided to women and children, which include the health management for children of 0 to 6 years old, vaccination service, and health management for pregnancy and delivery women. It's basically free access to all urban and rural residents. As for providers, it's basically the basic level medical institution. For example, the township hospitals, the village clinics, and the community health service stations and centers. However, with the number of pregnancy and delivery women, newborns, children number increase, the service numbers will increase. And in order to ensure the service quality, maybe the government funds will increase and the public health workers' workload will increase. That may be the challenge. And the last potential challenge is on the maternity insurance. In China, the urban employees is involved in an independent maternity insurance system, which can reimburse their reasonable delivery and related medical expenses. However, the urban and rural residents don't involved in an independent maternity insurance system. However, they can reimburse the expenses in the urban and rural residents medical insurance system. Previously, the maternity insurance system can reimburse just one time per women, but after the policy, it basically will reimburse 2 times for per women. Yeah. So maybe with the delivery women number increase, the reimbursement times will increase, and the reimbursement payments will increase. Here is a challenge: how to keep the fund balance. Maybe it will take attraction from the government. Just like the medical insurance, which is the mode of pay as you go, and how to keep the payments balance is really a challenge. Now, the Beijing and Guangzhou in China have reported that their maternity insurance funds were facing great pressure, even there has been the deficit. Yeah. And so, based on in order to cope with the challenge, we think that the maternity insurance should be adjusted according to a scientifically actuary analysis, and it should consider also related indicators. For example, the premium rate, the reimbursement standard, the delivery and the related medical expenses, and so on. Here's the conclusion. First, what are the potential challenges? Here I have shown before. It mainly includes 3 big aspects and 6 specific aspects. First, in medical service, is insufficient obstetric and pediatric medical resources and high delivery risk with advanced maternal age. Second, in basic public health service, first, more government fund needed and high working pressure of the public health workers. And the third is the service quality. In the maternity insurance, how to keep the fund balance is a big challenge. Yeah. So what can we do? First, a project with more specific analysis need to be conducted to narrow the challenges of the new policy on the maternal and children healthcare system. Subsequently, maybe adjustment scheme on each could be put forward and submit to the policymakers, thus to help China face the right challenges effectively. Yeah. Okay, that's all. Thanks very much.